Hello, welcome to MedZone by Dr.farjana Afrin. Today my video lecture topics leg. In this video lecture I am going to describe about the different compartment of the leg, anterior, lateral as well as posterior. Each compartment muscles name, nerve supply, action and some of the clinical anatomy. So let's start. First on screen you can see there are two figures. Let's denote them, figure A and figure B. On figure A, first see on the middle of the leg, if we do transverse section and if we see the figure, how does it look like inside? First of all, we will be identifying two bones inside to outside. If we see in the leg, we know there are two bones, one is tibia, another one is fibula, and there are different muscles also you can see, along with that vessels also there. And if we move outside, we can see there is a white patchy structures which is encircling the whole leg. There is a yellow color area and more outside also there is one more encircling structure. Now if we move from outside to inside, the first layer is skin. This yellow color patchy area is the superficial fascia. After that, most inside will be the deep fascia. The deep fascia, when encircling the whole the leg circumference, from this there will be inward some septum started to move. From there some inward septum will be moving, and even in between this tibia and fibula also there will be a interosseous membrane which is also a septum also can say. Then these are the deep fascia septum moving insides and dividing the whole leg into small compartment. What are the compartment? Anterior compartment, lateral compartment and posterior compartment. This posterior compartment again with the transverse septum, again from the deep fascia transverse septum move insides and divided the posterior compartment into two. One is the deep, another one is the superficial part of the posterior compartment. So at least we understood from here that in leg there are total three compartments: anterior, lateral and posterior. Posterior again divided into two, superficial and deep. And dissection wise, if we think outside to inside if we move, first layer will be going to get skin, then superficial fascia, then deep fascia, and deep fascia move insides and form intermuscular septum, interosseous membranes also there, and divided the whole leg into small compartment, each compartment having muscle, vessels and nerve. And leg have two bones, one is tibia, another one is fibula. Same things also described in the figure B. You can see again, let's see tibia and fibula, and the whole encircling is the deep fascia. Deep fascia move insides and divided the whole leg into small compartment. This is the interosseous membrane. So this is the transverse septum. This is the septum which is dividing the whole leg into small compartment. Anterior, lateral. This is the posterior. Posterior have two, superficial and deep. So these are the informations related with the leg different compartment. Now dissection wise, if we started to move insides from superficial toward the deep, what are the layers by layer we are going to get? Let's one summarize. So our topics of discussion is leg, and the first layer is skin. Skin as like it has two part or two layer, we can say epidermis and dermis. After that, superficial fascia, I am writing in shortcut. We know superficial fascia has some content. In leg also superficial fascia has some content. What are the content? We are going to get vein, I am writing in shortcut, nerve. Sometimes we are also getting artery and lymph also. So here also we are going to get such type of some structures in the superficial fascia. After that, there are deep fascia. The deep fascia here have some modification. Modification of the deep fascia we are going to get in this area. So questions may be asked, what are the modification of deep fascia of the leg? If they ask you, you have to answer number one, retinaculum. Retinaculum. There are some types of retinaculum: superior and inferior extensor retinaculum, superior and inferior peroneal retinaculum and flexure retinaculum. So what are that? Let's write here: superior and inferior extensor retinaculum, then superior and inferior peroneal retinaculum, and last one is the flexure retinaculum. Other than retinaculum, one more things also we are going to get, that is the intermuscular septum. That is the intermuscular septum. So, deep fascia is very strong, enclose the whole leg like a slave, and it has some modification. After that, we have to know that if we move inside, we are going to get muscles. Muscles, vessels, nerves together, so we can write also. Muscles are arranged in three compartments as it is separated by the intermuscular septum: anterior, lateral, and posterior. Posterior compartment again divided into two by the transverse septum, superficial and deep. And each compartment has their separate artery or branch of some different arteries, and it has nerve, artery and vein, we can write together also, artery, vein and nerve. So, that is all the first chronology wise. If we go from superficial to deep, what are the structures we are going to get? We are going to start from the superficial fascia to learn slowly. So, let us start. Now, on screen you can see there are two figures. Let us denote them, figure A and figure B. It is actually the anterior aspect of the leg. Keep in mind, anterior aspect of the leg and below the patella. This is the patella, this is the patella. So, first I am going to say figure A, here actually showing a vein. So, you can see superficial vein of the front of the leg and dorsum of the foot. So, superficial fascia, I already said it contain vein, artery, lymphatics and nerves also. So, first let us start with the vein. You can see on the dorsum of the foot there is a dorsal venous arch. The dorsal venous arch is receiving from the dorsal digital vein. These are the dorsal digital vein. From here there will be extension from the lateral side small saphenous vein and from the medial side great saphenous vein. These are all superficial vein. So, what are the superficial vein you got? Number 1 dorsal venous arch, number 2 dorsal digital vein, number 3 small saphenous vein, number 4 great saphenous vein. These are the superficial vein. On figure B, if you see, these are the nerve. So, these are the cutaneous nerve of the front and dorsum of the foot. Carefully see the cutaneous nerves, because the area of distributions of the cutaneous nerve sometime in exam we are asking MCQ, maybe we can give this side sensation loss. So, which nerve is here involved? So, you just see below the patella, just below the patella, infrapatellar branch of the saphenous nerve. This is the first one. You can see it pierces the deep fascia of the medial side of the knee and it will be supplying just below the patellar region, below the knee. Then one nerve is there, you can see this is the saphenous nerve. On the medial aspect, it is a long nerve running alone with this great saphenous vein. This is the saphenous nerve and supplied to the medial aspect of the leg and even to the medial border of the foot up to the ball of the big toe. It will be supplying. After that, see the lateral sides, there is a nerve which is supplying to the lateral aspect of the leg and cuff also. Name of that is called lateral cutaneous nerve of cuff. Its root value you can remember L5, S1 and S2. So, it will be supply skin over the upper two-third of the leg laterally, upper two-third of the leg laterally. Then superficial peroneal nerve. The superficial peroneal nerve, its root value is L4, L5 and S1. You can see here this is the superficial peroneal nerve. It arises from the common peroneal nerve on the lateral side of the neck of the fibula, and its superficial peroneal nerve, it will be supply skin over the lower one-third of the lateral side. You can see upper two-third is supplied by the lateral cutaneous nerve and lower one-third is supplied by the superficial peroneal nerve. So, skin over the lower one-third of the lateral side of the leg. Whole the skin of the dorsum of the foot also it will be supplied, and even cleft between the first and second toe which is supplied by the deep peroneal nerve, it is omitting. It is a very important point for MCQ. So, cleft between the first and second, cleft between the first and second, it will be not supplied by the superficial peroneal nerve. Which nerve will be supplied here? Deep peroneal nerve. So, cleft between the first and second toe which is supplied by the deep peroneal nerve. Then lateral border of the foot also will be not here, which is related with the small toe, but not properly, that is the sural nerve. Remaining everything will be supplied by the superficial peroneal nerve. So, this point we have to remember. First things is, again I repeat, the cleft between first and second toe, it will be supplied by the deep peroneal nerve. Along the along the lateral aspect of the foot, it will be supplied by the sural nerve, and remaining all will be supplied by the superficial peroneal nerve. And the already I said, the medial aspect of the foot also up to the ball of the toes, that area also will be supplied by the ball of the big toe will be supplied by the Stephanus nerve, and remaining everything will be supplied. I can change the color. These are all supplied by this superficial peroneal nerve. This point we have to remember. If question wants to ask MCQ, they can ask you either toward the most lateral aspect or between the web space of first and second. That is the little bit unique point we have to remember. And these digital branches, small these branches are the digital branches, small these are the digital branch of medial and lateral plantar nerve. Distal part of the dorsal aspect of the toe is supplied by the digital branch of medial and lateral plantar nerve. That's all about the front anterior aspect. Now, if we see to the posterior aspect, how they are distributed, the nerves. Let's see. Now, on screen you can see there is a figure showing vein and nerve. First, I will say about the vein. So, I am changing the color. You can see there is a vein which is starting from the lateral end of the dorsal venous arch. Behind the lateral malleolus started to move up, and just through the middle of the posterior aspect of the leg, it is started to ascend. What is the name of this vein? Small Stephanus vein. One more is there, name of that is called great Stephanus vein on the back of the leg. It is seen only into the posterior medial aspect of the back of the knee. Name of this is called great Stephanus vein. So, two vein here. One MCQ questions is important here. We are sometimes asking, small Stephanus vein on the posterior aspect of the leg accompany a nerve. What is the name of that nerve? Name of that nerve is called sural nerve. You can see it is accompany this vein. Name of this is called sural nerve. So, a small Stephanus vein on the posterior aspect of the leg accompany a nerve. What is the name of that nerve? Name of that nerve is called sural nerve. On the anterior aspect also we saw the great Stephanus vein also accompany a nerve. What is the name of that nerve? Stephanus nerve. Not only purely anterior aspect, toward the medial aspect of the leg, it will be accompanying. That's all about the vein related information. Now come for the nerve. Cutaneous nerve or the superficial fascia containing nerves on the posterior aspect, if you see, these are all yellow color demarcation. First one is the Stephanus nerve. You can see the branches of the Stephanus nerve here giving 1, 2, 3. These are the Stephanus nerve. It pierces the deep fascia in the medial side of the knee, accompany the great Stephanus vein as I said, and in front and behind also it will be supplied. It supplies skin on the medial side of the knee, leg, medial border of the foot up to the ball of the big toe, and it will be giving a posterior deviation which will be supplied toward the back. Then posterior division of the medial cutaneous nerve of the thigh. You can see here posterior division of the medial cutaneous nerve of the thigh. It will be also supplied toward the medial aspect of the leg posteriorly, posteriorly. Then posterior cutaneous nerve of the thigh. Here you can see posterior cutaneous nerve of the thigh. This is the posterior cutaneous nerve of the thigh. So, posterior cutaneous nerve of the thigh, posterior division of the medial cutaneous nerve of the thigh, branches of the Stephanus nerve you got, then sural nerve I already said, this is the sural nerve, and then you got lateral cutaneous nerve of calf. Here you can see this is the lateral cutaneous nerve of the calf, and also you got sural or peroneal communicating nerve. The point what we have to remember from here is posterior cutaneous nerve of thigh is here supplying on the back side. Posterior division of the medial cutaneous nerve of thigh is also supplying in the back side. Then some of the branches from the Stephanus nerve is also supply here. Then lateral cutaneous nerve of calf is also supplying here. Peroneal branch is supplying here, and sural nerve is also supplying here. These are the nerves which is supplying to the cutaneous area or skin sensation on the back of the leg region. Here also you can see the different area of distributions of the nerve showing. So, with the different color demarcation, it is showing the different nerves area of distribution with each of the nerves root value, like lateral cutaneous nerve of the thigh L2 L3, medial cutaneous nerve of thigh also L2 L3, then lateral cutaneous nerve of calf L4 L5 and S1, sural nerve L5 S1 S2, Stephanus nerve L3 and L4, sural nerve L5 S1 S2, and medial calcaneal branch of the tibial nerve S1 and S2. Root value here, it is not that much important, but main important is the area of distribution. If examiner can ask, examiner ask you like this way, that on the medial aspect of the legs the sensation is lost, you have to remember which nerve is here involved. Nerve is Stephanus nerve. So, such type of questions MCQ times also we can ask. So, in the superficial fascia mainly we discussed about vein and nerve here, which is the content in the superficial fascia of the leg. Now come for the deep fascia. As I said, deep fascia have modification. Already intermuscular septum I said, the intermuscular septum, transverse intermuscular septum divided the whole muscles of the anterior compartment, lateral compartment and posterior compartment individually. So, intermuscular septum related I am not going to explain again. Come for the retinaculum. I will show you the retinaculum first here. The retinaculums are the deep fascial thickening band which will be holding the tendon passing from anterior or lateral or posterior compartment of the leg towards the foot. That is their main function, the retinaculum. So, let us see what are the retinaculum. Now, on screen you can see there is a figure showing the retinaculum, superior extensor retinaculum, then there is inferior extensor retinaculum. So, I am changing the color. This is the superior extensor retinaculum which is holding the muscles tendon coming from the leg towards the foot. They are all extensor muscles, anterior compartment of the leg muscles. Then you can see inferior extensor retinaculum which has a Y shape of band. It also helps in hold all the tendon passing underneath these. These are the two retinaculum, superior and inferior extensor retinaculum. Then there are two more retinaculum. We are seeing superior and inferior peroneal retinaculum. Let us see. So, on screen you can see there is a figure. Let us denote them, figure A and figure B. Here you can see the retinaculum. Let us see, this is the inferior extensor retinaculum. Just before some time I said it has a Y shape of features, and this is the superior extensor retinaculum. So, this is superior extensor retinaculum, lateral view of the leg showing, and this is the inferior extensor retinaculum, anterior view I already showed. After that there is tibio fibular, there is fibular retinaculum also. So, this is the superior and inferior peroneal or fibular retinaculum. These are the two retinaculum. These are the two retinaculum. So, superior and inferior peroneal or fibular retinaculum. Then on figure B you can see there is a retinaculum. This is called flexor retinaculum. The flexor retinaculums underneath the flexor tendon will be passing. You can see these are passing, and this retinaculum main function is to hold this all the tendon, nerve, vessels in a places in secured manner. So, this is the flexor retinaculum, which is a posteromedial aspect of the ankle region it is located. That is all about the retinaculum related information. So, after the skin, superficial fascia and deep fascia, now we are going to describe about the compartment wise. Our first topics of discussion is the anterior compartment of the leg. So, let us start. Now, on screen you can see the anterior compartment of the leg muscles. So, let us start. Anterior compartment of the leg, it has some muscles. What are the muscles? Muscles is number 1, tibial is anterior. Number 2, extensor hallucis longus. Number 3, extensor digitorum longus. And number 4, peroneus tertius, or we can say fibularis tertius. What is the artery of this compartment? These are the muscles. So, what is the artery of this compartment? Artery is anterior tibial artery. And what is the nerve of this compartment? Nerve of this compartment is deep peroneal nerve. And group function, anterior compartment muscles, another name is called extensor compartment. Extensor compartment. So, it will do extension of ankle, but we know there is no extension of ankle, there is dorsiflexion and plantar flexion. So, these all muscles will do action, if we want to say, this all muscle will do dorsiflexion. So, common function of this all muscle should be dorsiflexion on ankle. Though they have some specific function also on ankle. Though they have some specific function also, I am going to describe when I am going to say individual muscles. So, let us start individual muscles related information. First, tibial is anterior. On screen you can see there is a figure showing tibialis anterior muscles. Number 1, tibialis anterior muscle. Tibialis anterior muscles arises from the upper 2/3 of the lateral surface of the tibia. So, it will be arises from the upper 2/3 of the lateral surface of the shaft of the tibia, adjacent part of the interosseous membrane also. And where does it get inserted? Medial surface of the medial cuneiform regions it will be inserted. Number 1. Adjoining part of the base of the first metatarsals also it will be inserted. So, cuneiform and base of the first metatarsal is the point of insertion. These are the point of insertion. What is the function of the tibialis anterior? As I said, when a muscle we are going to describe group function we have to know. So, first group function is dorsiflexion, dorsiflexion of the ankle, It has some other function also. What are the other function? It is the inversion. It is doing inversion of foot, and it maintain the medial longitudinal arch. Maintain medial longitudinal arch. That's all about the tibialis anterior. Next come for extensor hallucis longus, same side. Extensor hallucis longus, it arises from the medial 2/4 of the medial surface of the shaft of the fibula. So, this extensor hallucis longus will be arises from the fibula region, and these muscles will be inserted into the base of the distal phalanges of the big toe. As name is hallucis, so it will be inserted into the base of the distal phalanges of the big toe. So, what is the function of this extensor hallucis longus? Common function will be, of course, it will be helps to do dorsiflexion of the foot. It will be helps, and main function is to extension of the great toe. Extension of great toe, because it is inserted into this great toe. Extension of the great toe distal phalanges area. Next is the extensor digitorum longus. Extensor digitorum longus, name is digitorum, so it has contribution into the all digits 2 to 5th. So, extensor digitorum longus, it arises from the upper whole of the upper 1/4 of the medial part of the anterior aspect of the fibula also, middle part of the fibula also. After that, it will be inserted into the medial as well as the distal phalanges of the 2 to 5th toe. Now, this extensor digitorum longus, its function will be what? Of course, its common action will be helps in do dorsiflexion of the foot. Its common action. Its specific action will be extension of metacarpophalangeal, proximal interphalangeal and distal interphalangeal joint. So, extension of metacarpophalangeal, proximal interphalangeal and distal interphalangeal joint, of which toes 2 to 5th, you have to remember. That is all about the extensor digitorum longus. After that, there is one more muscles you can see now in this figure. Name of this is called peroneus tertius. Peroneus tertius, it is arises from the peroneum, that means fibula, lower 1/4 of the fibula, it is the point of origin, and adjacent interosseous membrane also, where it will be inserted dorsal surface of the base of the 5th metatarsal. This is the 5th metatarsal, this is the base of the 5th metatarsals. Here will be inserted. What is the action of the peroneus tertius? Peroneus tertius common action will be same like dorsiflexion of foot, and specific function will be it do eversion of the foot. This is the specific function. Common function dorsiflexion of the foot, and specific function is eversion of the foot. So, from here we got two muscles, one do inversion, another do eversion. This is important for us, we have to remember. So, who is doing inversion of foot? You can see here I already mentioned inversion is done by the tibialis anterior muscles. So, inversion is done by tibialis anterior. And which muscles do eversion? Now we got peroneus, tertius. These muscles do eversion. So, though slowly we are going to get more muscles also helps in doing this action, but let us note down them. Inversion of the anterior compartment muscles is tibialis anterior, eversion of the anterior compartment muscles is done by the peroneus tertius. Now, there is a condition in the anterior compartment we are going to get specifically if the person is over doing exercise and the muscles of the anterior compartment, specifically when the untrained persons do vigorous hard work, there is a possibility the muscles get in this compartment swelled, tight compartment due to the sudden overuse of this venous return loading. So, there might be accumulation of fluid. Now, there is a condition we are saying it is called anterior tibial compartment syndrome, shin splints or Fascia syndrome. What happened? For example, a person untrained and started to do vigorous exercise all in a sudden, and what will be happen? There will be lack of venous return, and that may leads to accumulation of fluid inside the compartment, and pressure tends to compress the anterior tibial artery, reducing the blood supply to the muscles, leading to ischemia and severe painful situation. It is frequently seen in the freshers, as I said. So, newly admitted medical students or might be army persons. That is why its another name is called freshers syndrome also. So, actually what happened, due to vigorous exercise, the venous return will be impaired, accumulation of excessive fluid will be there, which may leads to compression of the muscles, vessels in the compartment, specifically the artery, and that may leads to ischemic situation in the muscles, and severe pain will be there. This condition we are saying it is called anterior tibial compartment syndrome or Fascia syndrome. Now, in the anterior compartment we got a artery which is supplying, I said name of this artery is called anterior tibial artery. Now, anterior tibial artery related some information we have to remember. Anterior tibial artery, it is the main artery of the anterior compartment of the leg, and it arises from the popliteal artery. So, it is the smaller terminal branch of popliteal artery. And this anterior tibial artery have some branches. What are the branches? Anterior and posterior tibial recurrent artery. So, here I am writing what are the branches? Anterior and posterior tibial recurrent branch. Then one is muscular branch, and anterior medial and lateral malleolar artery, anterior medial and anterior lateral malleolar artery. If it is possible for you, try to remember the name of the branches. Even in this compartment we got a nerve also, name of that is called deep peroneal nerve. Deep peroneal nerve, it is the main nerve of the anterior compartment of the leg. It arises from the common peroneal nerve. That is all about the anterior compartment of the leg related information. Now, as we discussed about the anterior compartment of the leg, let us continue the dorsum of the foot. So, dorsum of the foot, it has two type of muscles. One is extrinsic tendon, which is I already said from the anterior compartment, from the lateral compartment, from the posterior compartment, the muscle tendons are moving toward the leg. So, this type of muscles which is originating from the legs but inserted into the foot area, this type of muscles we are saying it is called extrinsic muscles of the dorsum of the foot. And the muscles which is originating as well as insertion into the foot, that is why we are saying it is called intrinsic muscles, especially into the dorsum region. So, the muscles of the dorsum of the foot can be categorized into two, one is extrinsic, another one is intrinsic. Keep in mind, in the dorsum of the foot, intrinsic muscle is only one. It is important one point, and name of that is called extensor digitorum brevis. Now, this extensor digitorum brevis, it originates from the calcaneum. You can see here, this is the calcaneum. So, superior surface of the calcaneum is the point of origin. and when it is inserted it is splitted into 4 tendon. Medial 4 toes will be the tendon for the big toes, then middle, second, then third, then fourth. It will be not inserted into the fifth toe. This is important, we have to remember. That is all about the muscle of the dorsum of the foot related information. In this dorsum area there is a artery. Name of this artery we are saying dorsalis pedis artery. So, this dorsalis pedis artery, it is direct continuation of the anterior artery. It has so many branches, it is not that much important. The importance is you have to remember this dorsalis pedis artery we can felt and we can check the arterial pulsation also, and it often palpated shuffling or maybe because of a venous occlusion it may be fragile, and a specific one disease condition we are saying where the arteria dorsalis pedis will be very much fragile. Name of this condition is called Burgess disease. So, where we can check this arteria dorsalis pedis, we are checking in between the first and second wave space, just at the head of the first and second metatarsals region. Here we can press and we can get the arteria dorsalis pedis pulsation. Now we are going to discuss about the lateral compartment. Lateral compartment. The lateral compartment of the leg, it has only two muscles. Number one is peroneus longus, number two is peroneus brevis. Only two muscles are here. Now, these peroneus longus and brevis are supplied by a nerve, name of that is called superficial peroneal nerve. You can see superficial peroneal nerve is actually coming from the common peroneal nerve. Common peroneal nerve is divided into two, deep and superficial. Deep goes to the anterior compartment, just before some time I already said, and now superficial, which is supplying to the lateral compartment of the leg. As there are only two muscles, very shortcut we can go through. First come for the peroneus longus. Peroneus longus, it arises from the upper two-thirds of the lateral surface of the fibula. So, this is the fibula, and longus, so it is a long muscles. Where does it get inserted? After crossing from the lateral side it is originating, because it is originating from the fibula. The tendon of the peroneus brevis also along with the peroneus longus, it will be coming through a common tendon of superficial peroneal retinaculum. You can see here, these are the retinaculums, and it will be goes behind the lateral malleolus. It will be going behind the lateral malleolus. Peroneus longus will be going behind the lateral malleolus, and underneath the peroneal retinaculum also, as I said, peroneal retinaculum will be holding. Then what will be happen? It will be going toward the insertion point. What is the insertion point? It will be inserted into the infralateral surface of the base of the first metatarsal bone. So, it will be from lateral side it started to move to underneath the foot, it will be go to the medial aspect and inserted into these bones. What are that? Number one, medial cuneiform, and number two, base of the first metatarsal. So, it started from the lateral side, going behind the lateral malleolus, under cover of the retinaculum, and underneath the foot it will be started to move toward the medial side for insertion. Where it is inserted? Medial cuneiform and base of the first metatarsal. That is all about the peroneus longus. Nerve supply, I already said, the lateral compartment nerve is the superficial peroneal nerve. Come for its action. It is little bit important for us. Peroneus longus is a chief everter. Chief everter. So, it is a chief everter of food. I already said there are some everters and inverter we are going to get slowly. Already we got a everter of the foot. Now, one more we got, but it is a chief everter of the foot. Then it also maintain, its another function is to maintain lateral longitudinal arch. Medial longitudinal arch maintained by the tibialis anterior, lateral longitudinal arch is maintained by the peroneus longus. It also maintains the transverse arch of the foot. So, number one function is it is a chief everter of the foot. Number two function is it is maintain the lateral longitudinal arch. Number three function it also maintain the transverse arch of the foot. These are the function of the peroneus longus. Now come for the next muscle, that is the peroneus brevis. This peroneus brevis, where from it is originating? Let us see. The peroneus brevis originating from the lower two-thirds of the lateral surface of the shaft of the fibula. So, it is little bit short muscle compared with the peroneus longus. So it will be arises from the lower 2/3 of the lateral surface of the shaft of the fibula and intermuscular septum also. Where does it get inserted? It will be inserted into the base of the fifth metatarsals, base of the fifth metatarsal. This is the insertion point. Nerve supply already we know, that is the superficial peroneal nerve. What is its function? Peroneus brevis is doing, what is its action? It is also doing eversion. So everter of foot, everter of foot, and it also helps in maintain the lateral longitudinal arch. Now if you can remember, we wrote the everter. Let's see. So what are the muscles do eversion and inversion? Here we already wrote eversion of foot. Peroneus tertius, we got peroneus longus, and another one we got now peroneus brevis. You have to remember, this is the chief. So chief everter of foot is the peroneus longus, but this all three can helps to do the eversion of foot. It is a point of MCQ. Now related to the eversion and inversion of the foot, there are two congenital conditions we can get, or maybe because of injury to the superficial peroneal nerve also we can get. Now on screen you can see there are figures showing, first is figure A showing talipes varus and talipes valgus. In talipes varus, the injury of the superficial peroneal nerve, paralysis of the peroneal muscles associated with overactivity of the inverter muscles. So here you have to remember, everter muscle is not working. So inverter muscles become more active. So the foot become inverted. Please keep in mind. Which muscles paralysis? Muscles paralysis will be everter muscles. So if talipes varus they ask you which muscles paralyze, you have to remember the muscles which are doing eversion. The everter of foot get paralyzed. So the inverter is hyperactivated and muscle will be helped to do inversion of foot. This condition we are saying it is called talipes varus. The opposite will be happen into the talipes valgus. The overactivity of the peroneal muscles, because there will be inverter of the foot get paralyzed. So here which will be get paralyzed? Inverter. So inverter of foot it get paralyzed. So here which muscles is get overactivate? Here muscles will be get overactivate will be the peroneal muscle, that means peroneus longus, peroneus brevis, even peroneus tertius also. Sometimes you are asking if here is the superficial peroneal nerve injured, in case of talipes valgus which nerve is injured? You have to remember anterior tibial nerve. So in case of talipes varus, nerve injured is the superficial peroneal nerve, muscle paralysis will be the peroneus group of muscles, and in case of talipes valgus, anterior tibial nerve is injured, anterior compartment, that means the extensor compartment of the leg muscles will be get paralyzed. What are that? Tibialis anterior, extensor helicis longus, extensor digitorum longus, and peroneus tertius. But here mainly you have to remember the muscle is the tibialis anterior. Please keep in mind, here mainly muscle will be the tibialis anterior, as it's doing inversion of foot. So these muscles get paralyzed, anteritibial nerve is injured, so the foot will be giving to talipes valgus type of feature. After the lateral compartment of the leg, let's discuss about the back of the leg, that means the posterior compartment. Posterior compartment. Posterior compartment of the leg, it has two group of muscles, superficial and deep. What are the superficial muscles? Gastrocnemius, then soleus, I am writing in shortcut, and plantaris. These are the superficial group of muscles. What are the deep group of muscles? The deep group of muscles are tibialis posterior. Let us write here the superficial group. This is the deep group. Number 1, tibialis posterior. Number 2, flexor digitorum longus, I am writing in shortcut. Number 3, flexor hallucis longus, and number 4, popliteus. These are the muscles. Here muscles are supplied by the tibial nerve, which root value is, nerve supply if I am writing here, nerve supply should be tibial nerve. Its root value is S2 and S3 here. Though in the popliteus it will be coming from the L4, L5 and S1 also. Maximums are S2 and S3, but there are some difference also, like tibialis posterior will be supplied by the root value from L4 and L5. Popliteus will be getting root value from the L4, L5 and S1. So these are the point we have to remember. Let's start one by one muscle description. Now on screen you can see there are superficial group of muscles showing. First let's start with the gastrocnemius. Gastrocnemius, it has two head, medial head and lateral head of the gastrocnemius, and arises from the femur, lower end of the femur. Lateral head arises from the lateral surface of the lateral condyle of the femur. Medial head arises from the medial surface of the posterior aspect of the medial condyle of the femur. So it is the origin point. Keep in mind, in the lateral head of the gastrocnemius underneath there is a sesamoid bones origin, name of that is called fabella. After the origin, along with the soleus, it will be inserted into the posterior surface of the middle part of the calcaneus. What is the function of the gastrocnemius? Plantar flexion of the ankle, and flexes the leg also at the knee. So function of the gastrocnemius, if we see the action, it will be plantar flexion. We know dorsiflexion done by the all anterior compartment of the leg muscle. Now posterior group of muscles we are going to see, they are doing plantar flexion. So gastrocnemius, both the head doing plantar flexion, and also it helps in flexion of the leg at knee joint. Come for the soleus. Soleus, it will be arises from the soleal line, we already know, in the tibia posterior surface, and along with the calcaneus it will be also inserted into the, along with the gastrocnemius, it also inserted into the calcaneum middle part. What is the soleus function? It also helps to do plantar flexion. Soleus muscles, we are saying it is called peripheral heart, because soleus muscles inside there will be large venous sinusoids. It can accumulate the blood, and by pumping it can propel the blood toward the heart. That's why we are saying soleus is a peripheral heart, as it contains large venous sinusoids which can accumulate more blooded insides, and it can pump the blood towards the heart also by contraction. Another point we have to remember, that is triceps surae. Sometimes we are asking what are the structures forming the triceps surae. The two head of gastrocnemius plus soleus, this all together we are saying it is called triceps surae. Then one more muscle is called plantaris. This is also superficial muscles. Gastrocnemius, soleus, after that plantaris. Plantaris homologous muscles in our upper limb is the palmaris longus. It has very short belly and long tendon. Plantaris muscles, it is arises from the lateral supracondylar line of the femur and oblique popliteal ligament, and it inserted into the again calcaneum toward the medial aspect along with the gastrocnemius and soleus. It is a very weak plantar flexor, very weak plantar flexor. Plantar flexor, very weak. It has short belly, long tendon, so we can use for tendon grafting also. Now first I will explain about the deep muscles. Let's see. Popliteus. Popliteus arises from the anterior part of the popliteal groove on the lateral condyle of the femur. Lateral condyle of the femur, from here it is arises. Where it is inserted? The tendon will be inserted in the middle two-thirds of the triangular area above the soleal line. We know there is a soleal line, and above it will be inserted. Now these popliteus muscles have a very unique function. It helps in unlock the knee. This is the only one muscles which is doing unlocking action. Quadriceps muscles will do locking, and popliteus muscle will do the unlocking. So this is important. Next come for flexor digitorum longus. Flexor digitorum longus, upper two-thirds of the middle part of the posterior surface of the tibia, below the soleal line. You can see this is the soleal line. So below the soleal line, it will be started to origin, and it will be inserted into the base of the distal phalanx of the lateral fourth toe. You can see 2, 3, 4, 5. These lateral 4 toes, base of the distal phalanx, it will be get inserted. What will be the function? Plantar flexion, of course. So it will do plantar flexion of lateral 4 toe. It also maintain the lateral longitudinal arch. These are the two functions of the flexor digitorum longus. Come for flexor hallucis longus. Flexor hallucis longus arises from the lower 3/4 of the posterior surface of the shaft of the fibula and adjacent interosseous membrane. Where it is inserted? It inserted into the base of the distal phalanges of the great toe. As it is hallux, so it will be inserted into the great toe. So from lateral side it start, cross the midline and come to the great toe for insertion. What is its function? As it is inserted into the great toe, so its function will be flex the great toe. Flex the great toe. Number 1. It plantar flex the ankle also very weakly. Plantar flex the great toe. And it support to maintain the medial longitudinal arch. It also helps in support the medial longitudinal arch. The last muscle is the tibialis posterior. Tibialis posterior, it arises from the upper 2/3 of the upper part of the posterior surface of the tibia, below the soleal line regions also it is coming. It also arises from the fibula posterior surface, upper 2/3 of the posterior surface of the interosseous membrane also it is arises. It's a quite big muscles, arises from the tibia, fibula as well as interosseous membrane. And it divided into, as it is coming down, it is dividing into multiple tendinous small insertion, and all the tarsal bones it will be inserted, but except only one bones, name of that is called, it will be chiefly doing insertion into the navicular bone, and it will be passes to 2 to 4th metatarsals also. Everywhere it will be inserted except to the talus. It has insertion tendon slips into the everywhere except to the talus. What is its function? Tibialis in posterior, it is the inverter of foot. So tibialis anterior also was inverter of foot. Now tibialis posterior is also a inverter of foot, and it also helps in maintain the medial longitudinal arch. Tibialis anterior also maintain the medial longitudinal arch. So medial longitudinal arch is maintained by the tibialis anterior, tibialis posterior and flexor hallucis longus. So that's all about the posterior compartment of the leg deep muscles. As we said, the posterior compartment of the leg muscles are mainly supplied by the tibial nerve, its different root value. And if we think about the action, like popliteus is doing unlocking. Other than this, maximum muscles have a common function. What is their common function? This posterior compartment of the leg muscles will be helps in to do the plantar flexion. Maximum muscles function is to do the plantar flexion. And maintain some of the arches also, medial longitudinal arch or lateral longitudinal arch. And there is one more function also, quite unique function, popliteus doing unlocking, maximum muscle doing plantar flexion, and there is one more muscles which is quite unique function doing, that is the inversion. Who is doing this? Tibialis posterior. Tibialis posterior is doing the inversion of the foot. So that's all about the posterior compartment of the legs, its nerve supply related information. Now in this area there is a artery. What is the artery of this posterior compartment? It is supplied by the peroneal artery. The peroneal artery is the most important branch for the posterior area, posterior compartment, and it is the largest important branch from the posterior tibial artery. Keep in mind, posterior tibial artery, it is arising from the tibial artery. We know tibial artery is divided into two, anterior and posterior. So in these back sides it will be supplying, the peroneal artery will be supplying to the back of the leg area. It is a branch of the posterior tibial artery, largest and most important branch it is of the posterior tibial artery. Now as we discuss about the posterior compartment of the leg, posterior compartment of the leg has artery. What is the name of that artery? Name of that artery is called posterior tibial artery. Posterior tibial artery. The posterior tibial artery, it is the larger terminal branch of popliteal artery. Popliteal artery. and it is the only one branch not only supplied to the posterior compartment but also supplied to the lateral compartment of the leg. If you can remember, lateral compartment I didn't say it about the any artery name. So from the posterior tibial artery, one branch will be go to supply to the lateral compartment of the leg also. So posterior tibial artery related, these are the information in the posterior compartment of the leg you have to remember. What are the branches does it give? It gave a number of branches. Number one is fibular artery. It is the largest important branch and it will be go to the inferior border of the popliteal regions. It will be started to arise. So first branch is called peroneal branch. Peroneal branch. Number two is called muscular branch. Muscular branch. Number three is called nutrient branch or nutrient artery. It is the largest artery in the body. It enters into the nutrient foramen of the tibia below the soleal line. Number four is circumflex fibular artery. Circumflex fibular artery. Number five is communicating branch. Communicating branch. Number six is medial malleolar branch, calcaneal branch and terminal branch also we are going to get. So medial malleolar branch. Number 7 calcaneal branch and number 8 will be the terminal branch. Medial and lateral plantar arteries are the terminal branch. What are the terminal branch? Terminal branch will be medial and lateral plantar arteries. So that's all about the posterior tibial artery related information. Now a clinical condition, let's learn tennis leg. It is the painful calf injury. Mainly injured muscles will be the medial head of the gastrocnemius, as its musculotendinous junction is overstressed by the tennis playing player, and it occurs as commonly in the tennis player. That's why its name is called tennis leg. So that's all about the leg related lectures. I describe all the three compartments: individual compartment, muscles, vessels, nerves, and some of the clinical anatomy related with some of the compartment. Thank you for listening.